anomalies related to development of female genital tract. Number 1 shows the failure of union of both the para-mesonephric duct. So the entire female genital system is duplicated. So this condition is called as uterine didelphius, meaning everything is 2 in number. The fallopian tubes are 2 in number, the uterus is 2 in number, the vagina is 2 in number. You can see number 1, that is uterine didelphius. Second condition is a condition in which the upper portion of the uterus, the fundus of the uterus, you can note it is really bulged. So this is due to abnormal union of the middle horizontal portion of the para-mesonephric ducts, resulting in arcuate uterus. The third condition, you can see it appears like uterus has got 2 horn like projection similar to the horn of a horse or a cow, like that it is appearing now. So therefore it's called as bicornuate uterus. In number 3, that condition, bicornuate uterus, you can see the vagina is completely developed. Okay, it is a single vagina. Fallopian tubes as usual is 2 sides will be normal, but the uterus, you can see 2 horn like projection, 2 uterus like things are there. Okay, the uterus is resembling the horn of a horse or a cow. That's why it's called bicornuate uterus. So once you understand bicornuate, you can clearly understand the next condition, that is unicornuate uterus, wherein one of the para-mesonephric duct has failed to join with the other one and it has regressed. Regress means failed to develop. So only one complete vagina is there, one complete fallopian tube is there, and only one half of the uterus is alive or functional. That is called unicornuate uterus. Number 4, whatever I told until now is number 4, unicornuate uterus. Moving on to the next one, we can see there is the 2 para-mesonephric duct as united to form the uterus, the vagina, but in the, you can see in the lower part of the uterovaginal canal there is incomplete apoptosis or cellular separation, resulting in the cervix of the uterus meeting the vagina is not broken. So this is abnormality in the clearing of uterovaginal canal. Also the fundus has got a depression. It can be called a subarcuate uterus because the arching pattern of the uterus is gone. Subarcuate uterus is number 5. Number 6, along with subarcuate uterus, you can see the lower portion of the uterovaginal canal. Uterus is normal, but you can see the vagina, there is a failure of canal vagina. So we can tell that the vagina is failed to develop in this condition, resulting in imperforate vagina or imperforate canalization, imperfect canalization. That is number 6. Number 7, you can see a clear wall in the center. There is a union of the 2 para-mesonephric duct, but the central wall has failed to disappear completely. It is appearing like a wall in the middle of both the nasal cavity. What will you call that wall in the middle of both nasal cavity? Yeah, if you are told nasal septum by now, you are told correctly nasal septum because it is there in nasal cavity. So this is within uterus. So what septum is this? It is uterine septum. Number 7 is uterine septum. Number 8 is it has united with both the sides, but the lower portion you can see the vagina, there is complete failure of separation of the vagina. Canalization of the vagina is absent. That is number 8. Okay, you can see from 8 to 9 there is canalization is happening. I think 8 to 9 they are trying to show how the vagina develops. So in 8 there is failure of canalization of vagina. In 9 it is normal. The lowermost part of the vagina you can see one membrane, okay, one white color barrier. It is called hymenal membrane. Normally it should rupture, okay, at the time of delivery it will get ruptured so that there is complete canalization. Occasionally in some of the female individual it would have not been ruptured, so they will have normal menstrual cycle will be there in the uterus, but the fluid won't come outside. So that condition is called imperforate hymen. They will have cyclical changes, okay, in their body, secondary sexual character, everything will develop. Menstrual cycle will be absent. After 1 or 2 months they will get infection in the uterus because all the menstrual fluid will stay within the uterus and vagina, resulting in a bulge in the pelvis. So they will have infection in their pelvis if they have lack of menstruation. They will have pain, everything. But imperforate hymen results in condition failure of rupture of the hymen. That is condition number 9. So I hope you understood this developmental anomalies related to the fallopian tube, uterus and vagina, or related to paramesonephric duct, also called Mullerian duct. Thank you for watching and learning.